Hello, my name is Christine, along with Belgizio, Nicole, Stephen. We're Team 8. Today we'll be talking about the US telemedicine market in an elderly population. The telemedicine market is a sub-industry in the wider healthcare industry and includes companies operating the telehealth platforms and individuals utilizing the service. Among these individuals are elderly patients over the age of 65, which comprise 1/4 of the US market, but face the greatest difficulty in accessing telemedicine. A study from 2018 surveyed elderly citizens found that 38% of older Americans were not ready or able to use technology to receive their care from their physicians, with 72% of those are 85 and older. Prior to COVID-19, telemedicine utilization was minimal due to cost and regulations. Once COVID began, Medicare, followed by all insurances, waived all the HIPAA and privacy requirements to facilitate transition to telemedicine. Alongside the shift to telemedicine has been a general disruption for elderly patients and their care, some of whom receive inpatient care, such as an in-hospice setting. Care is strained due to COVID-19 risk and strained in telemedicine due to technological unreadiness. Telehealth is a primary service now. Production and demand chain changes to provide day-to-day benefits with the same quality to patients, creating potential disruption in the market's supply chain. A general economic depression can reduce the overall performance of the market and cause a financial impact on all the companies. Because there is so much flux in the broader economic picture, industry suppliers are able to assume high demand and therefore raise prices in the short term. In general, most economic activity has been shifted to short-term decision-making. This can be especially stressful for elderly care patients, which is often more intensive and chronic.
So we chose to look at two frameworks for telemedicine in the elderly: innovation and clinical quality. So innovation is defined as the introduction of ideas, processes, procedures, and products into a market. And certainly telemedicine fits into that definition. Telemedicine has really changed the healthcare delivery, specifically around elderly populations. Things like the smart home, which will allow patients to have a lot of the same access to technology in their home as they would in the hospital or the ER setting, has really changed the way the healthcare is delivered. Accessibility and usability are really looking at how patients, especially our elderly patients, are able to access telemedicine. Platforms have really gone a long way to make it easier for them to get in and to make sure that they're able to access that information from telemedicine from different platforms such as kiosks, computers, iPads, and smartphones. Clinical quality is really looking at healthcare outcomes, and telemedicine can certainly be looked at that framework for improvement there. Care gaps in things such as cancer screenings, as well as the treatment of chronic diseases, can be affected by telemedicine and hopefully improved. Telemonitoring equipment such as blood pressure cuffs or pulse oximetry cuffs can also lead to improvements in clinical care, as those things can be sent to doctors in between visits, allowing them to manage patients more closely and improve clinical quality. The stakeholders that we looked at were Medicare and elderly patients. So Medicare has certainly not been a friend to telemedicine historically. There has been underpayment and lack of parity in the payment of telemedicine visits and inpatient in-office visits. This has led to a huge barrier with patients and providers not wanting to do telemedicine because of that lack of parity. Post-COVID, we have seen improvements in Medicare payments through the CARES Act, as well as through the public health emergency, which has allowed this parity to persist and really improve the adoption of telemedicine by our elderly population. Medicare has also looked at telemedicine as a way to improve value-based care delivery, specifically around making sure that patients are getting the same value of care and the same types of care in their home through telemedicine that they could get in the ED or in the hospital, and also making sure that patients avoided these places which are high-cost care facilities. And then Medicare has provided technology provisions, providing iPads and smartphones, as well as telemonitoring devices to patients so that they're better able to utilize telemedicine in their home. Elderly patients are our other stakeholder. There were barriers in the past to using telemedicine. A study by the University of Michigan in 2019 found that Some of these things included connection. They didn't feel like they were able to connect to their doctor the same way on telemedicine as they would have in an in-office visit. They were concerned about privacy so that someone would be able to access their health information. And then deficits in hearing and sight were also cited as barriers for using telemedicine. Payment reform will be driven by elderly patients as stakeholders. They are often on fixed incomes or are very concerned about escalating healthcare costs. So they will make sure that telemedicine remains affordable not only for this population, but all populations in the US who are utilizing telemedicine.
COVID-19 has increased the percentage of people using telemedicine from 11% in 2019 to 76% in 2020. Teladoc Health, the largest telemedicine provider in the United States, saw 2.8 million virtual visits in Q2 of 2020, 3 times what they reported the same time last year. While many would believe it is the younger population who are leading the use of telemedicine, it is actually seniors who are leading the trend. As of August 2020, 36% of 55 and older in the United States, compared to only 9% of 18 to 24 years old, is using telemedicine. This is due to seniors seeing doctors more regularly compared to 18 to 24-year-olds who may see a doctor once a year. Since COVID-19 began, providers have seen a 50 to 175 times increase in telehealth services. A large reason for this is prior to COVID-19, many healthcare providers were hesitant to adopt telemedicine due to HIPAA violation risks and other general liability concerns. Next slide. While most healthcare professionals believe telemedicine is the future, professionals still are not sure of when, who, and how much. Will telemedicine be the norm in 5 years? What about 10? While healthcare physicians agree that annual checkups in some chronic conditions such as cancer will still be done in person, McKinsey & Company believe that 20% of office visits could be done through telemedicine. While there are many companies in telemedicine, there is also no clear winner in the healthcare space. There are also many software companies such as Microsoft and Amazon who want to contribute to the market but are not sure if they can take on the financial burden or HIPAA compliancy concerns with entering the market.
As the telemedicine market grows, a more intentional integration of business with humanity in mind principle is needed for the market to reach its full potential. Indeed, over the past few decades, there has been a growing need for business leaders to step into a leading citizen role and enable value creation in the healthcare industry beyond corporate profit. So to successfully integrate humanity values into telemedicine services for elderly patients, a route of change approach should be considered. This could be achieved through a principle-driven business education that will equip business leaders to effectively apply a human-centered approach into the telemedicine market. They could also facilitate the adoption of humanity as their organizational core values. Business leaders are in a unique position of authority to ensure that actionable and meaningful steps are being taken within their organization to prioritize patient centricity. They could even take a step further and extend their reach beyond normal market activities. For instance, they can use telemedicine services to reduce socioeconomic disparity in healthcare access for elderly patients. They could also better accommodate elderly patients' mental and emotional needs during health visits. However, it is critical to note that for a sustainable change to take place, business leaders must exercise active recognition of human capability gaps among their own employees and partners. They must also empower all these key stakeholders in the healthcare continuum through capacity building and continued support to better a humane elderly care in the telemedicine market. Thank you all for your attention.